Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. The patient you're seeing here is actually of a friend of mine, and they contacted me today on an emergency basis. They visited their barbers this afternoon to have their hair cut, and whilst they were there, they thought they'd have their ears waxed. You may have seen this latest trend where barbers are using hot wax, they're spreading it on the outside part of the ear, and then once it's set, they pull it away to try and remove all the hairs out. And that a lot of men, as we get older, due to built up testosterone, that only becomes kind of activated within the hair follicles in the ears and the nose later on in life. We do tend to grow a lot of hair as we get older in these unwanted regions. After having it done, he went home and he just felt his ears to be really, really itchy. So he pulled out the dreaded cotton bud and look at what he's done. He's pushed it really, really in. Now, this is the better one, guys. He's right here. He was an absolute agony. And I'll explain that in a bit more detail in a moment. So you're seeing the less troublesome of the two ears here. So I initially used microsuction, but it was quite stubborn. So I thought, well, this is a good opportunity for me to use my ear pick again that I've developed. And once more, it worked really, really well. So because it's so compressed and impacted, it can be difficult to sometimes suction it. So with the ear pick, it's got a slight curvature, and you can see the tip of the pick is angled away from the canal wall. And I could glide it. So in this case, the anterior canal wall. You just see the eardrum there now. And I've just come back out, and I'm going to go back in with the pick. And one of the things with the ear pick, because it's made up, it's reinforced with carbon fiber, it is extremely strong, and you can see me here really leveraging this out. In the wrong hands, I think the ear pick, like any instrument, can cause some damage because it has got a bit of a sharpened tip to help embed it, similar to the ear hook I've developed. So when you're extracting wax, like I just did there, sometimes what can happen is the hook or the Jobson horn or the ear pick can dissect through the wax, and all that strength and that pull that you have exerted on the hook means that the hook or the pick will become loose in the ear, and you've got the potential of making contact with the canal wall. So you've got to be really careful, like with any instrument, but more so with the pick, I would say. Now, I didn't use the pick in this side, and the reason for that is this was extremely painful for the patient, and you'll see on several occasions the patient moved their head. They were in agony, they were almost in tears. So as soon as I went in, I just put some olive oil. So when the patient attended, I actually did the right ear first. You can see the posterior canal wall is quite red. I've just put some olive oil spray just trying to loosen this. And on several occasions, you can see I'm going to have to suddenly come away because the patient had to move. And he apologised, but he said he couldn't help it because it was so painful. So what I did halfway through the right side, I paused the procedure. I played the recording back just so my friend was aware of what we're doing. I don't want him to think that the pain was caused by me poking and prodding and causing the pain. It was just the wax coming away. And it's always difficult when a patient's got already experiencing otalgia, so earache. So I just had to come away there prior to attending, because the first thing they ask is, and understandably, is it going to hurt? Now, if their ears are already painful upon attending, then unfortunately the answer is there may be some additional pain because your ears are already painful. And as an audiologist in the UK, currently we're not able to prescribe any local anesthesia. So I mean, there is a spray you can use, topical. It's called Clear Relief. It's got glycerol, and again it was a bit painful there, the patient jerked, and a bit of lidocaine, but it's just not going to be strong enough for this patient. Again, it was just a bit painful for him there. So because it was lodged right up against the eardrum, I think every time I was bringing it away, because it was stuck to the drum, and hence why I used the olive oil, he's feeling that pain. And you can see how tentative I am there. I just worried about the patient moving. If the patient wasn't moving as much, I would have reverted to the ear hook. But again, with the ear hook, because we're really, really deep in the ear, you've got to be careful. You've got to use the instrument selectively. I think someone asked me yesterday why I didn't use the ear pick sooner with that patient. And the reason for that, because it was so deep, I was worried that the ear pick may come in contact with the eardrum. So when you've got a case like this, when someone's really painful, suction is probably going to be the best option, because if the patient does move, it's going to cause less trauma because there's no real sharp edges. I'd rather the patient move suddenly now and the suction probe hits the canal wall. You can see there, I've just had to come away. But that, I think, not quite yet, I think. Oh, that might, this is a stage where you could hear a lot better. Yeah. So, although he suddenly jerked, I was able to bring this away from the eardrum, and he felt it. No, I think it was this part. There's twice he jerked. I think it was this section where, yeah, you can see now there's a gap at the bottom, and the patient could hear a lot better immediately. Yeah, so you're going to cause less trauma with the suction probe hitting the canal walls than you are with a sharp instrument. So hence why I persevered with suction. If worst comes to worst, and that wasn't going to budge, and I would have to contemplate using the hook. But you, as I explained, you have to use your instrument selectively at the right time. If all else fails, and I probably would have had to revert to the, or at least try it, but I've managed to use that, the suction, and it's less of two evils. If that's a way of describing it, you're going to have less risks with the suction probe, the ear hook. With the ear picks, you can see the ear pick there. You can see that curved, tapered tip. It helps me to embed into the wax. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.